One thing we're passionate about here at Metabolic Mind is sharing the individual experiences of people who have used ketogenic therapy to improve their lives and treat their mental disorders. We have the privilege of hosting a lived experience panel at the recent Society of Biological Psychiatry, the SOBP conference in Austin, Texas. And we want to share this panel with you. So introduced by our own Dr. Julie Milder and led by our own Ellison Baszucki, we hope you enjoy this lived experience panel. Welcome to Metabolic Mind, a nonprofit initiative of Baszucki Group, transforming the study and treatment of mental disorders by exploring the connection between metabolism and brain health. Thank you for joining us on this journey.
To kick off our afternoon, we are going to have a lived experience panel. Jan is going to moderate. We really feel strongly that hearing from those who have direct experience with their disorders, and then with this also we have the benefit of hearing about what metabolic therapy has done for these amazing people, that is really crucial to how we approach research. And so we like to integrate this perspective. We do it in our work all the time. And again, I'll just put another plug out there for going to the Metabolic Mind website and watching some of the videos that have been produced. They're incredible. But also we started integrating the voices of those with lived experience into any science meetings that we've had, because it is really illuminating. And so I'm really thrilled that we have Hannah and Lauren and Wes with us today, who are going to share their experiences. And Jan has lots of great questions for them. So come on up and join us.
So since our wonderful panel here is here representing themselves as people with lived experience, I thought I would introduce them as I would introduce someone speaking not about their lived experience and tell you about their credentials. So I'm going to read this part. Lauren Kennedy West has a BA in Social Development Studies and an Honors Bachelor of Social Work. She has a wonderful YouTube channel called Living Well with Schizophrenia that she has developed over the last 5 years with 300,000 followers. And I will let her tell the story of how that evolved. But we found out about Lauren because she had hosted Dr. Chris Palmer on her channel. And then I reached out to Chris and said, hey, has Lauren ever tried keto? And do you think she would be interested? And he said, no. And then Lauren reached out to me just a few days later and said, yes. So here we are. And Lauren will share about that channel and her keto journey. Wesley Braden is currently a senior marketing manager at Virta Health. He has a bachelor's degree in business managerial economics from Wheaton College. And we met, I guess, through a friend of my son's. You found out about ketogenic therapy independently, but then this connection was made, and we're super happy to have made that friendship with you. And Wesley, thank you so much for being here. And Hannah Warren, our very own Hannah Warren, is working with us now at Metabolic Mind and Baszucki Group as Mental Health Communications and Advocacy Manager. She has a Bachelor in South Asian Studies and a Master's in Fashion Entrepreneurship from University of London. So I want to start, and I sent these folks some questions in advance, but I wanted to start by asking you to describe your journey, but start before you got your diagnosis. How did people describe you? What were your dreams? What were your hopes and aspirations? And then talk about when you started to show symptoms, what you think the triggers might have been, and how that changed, who you were, how you saw yourself. And then we'll talk about ketogenic therapy. But I thought I would just ask each of you to describe yourselves before the diagnosis, and then describe what happened when you started to have symptoms, how you got diagnosed, and so on. So maybe we'll start with Hannah.
So prior, I always get this question if I saw any symptoms leading up to my first psychotic break, which happened at the age of 28. And kind of in retrospect, anything that looked like a sign that I would develop bipolar disorder kind of manifested as hypomania that really seemed like a good thing, actually. It gave me a lot of energy and enthusiasm and drive. I had been a very focused student. I guess who I was prior to my diagnosis, I went to a creative and performing arts magnet school. I loved dance and theater, art, creative writing. I was always kind of passionate about something and into some kind of project. I had an opportunity to go to India as a Rotary Ambassadorial Scholar and learned that I loved learning other languages. I learned to speak Hindi, really loved the culture, decided to do a degree in South Asian Studies, and I started a nonprofit organization in India that was focused on women's empowerment. We employed women in garment manufacturing so that they could earn a good living wage and get their families out of poverty. And that organization, I started that at age 24, and it started to become quite successful. We got some large grants from Rotary International, and I was given a scholarship to get my master's degree at London College of Fashion so that I could help to grow that organization. It was a fashion entrepreneurship degree. So it seemed like a really wonderful time in my life. Like, my future was bright. I was really passionate about what I was doing. Excited to help build that project and work towards eliminating global poverty. And, you know, there was really no indication that anything was going wrong. Actually, my mom came to visit me in London just a couple weeks before I had my first psychotic break. It really seemed to come completely out of nowhere. And as you can imagine, it was horrifying because I was in London. I didn't have family there. And it was like I was working on a paper one night, and I don't know, a lot of students are like this, right? I worked all night, and usually I'd synthesize my ideas and finish the paper and crash in the morning, but I just didn't crash. And before I knew it, I was up for days on end, started to hallucinate and become delusional, eventually wandered into a church where I asked to meet God and was quite confident that of course I'd get to meet God there.
I think lots of us think that we're going to find God in a church, so.
Right? But what did happen is they called the police, who escorted me to an inpatient facility there. And it was absolutely devastating. I was put on olanzapine, and within 6 months of taking that antipsychotic, I put on more than 70 pounds. After the mania, I became severely depressed and suicidal. And I just felt like a completely different person. I felt broken. I felt like I had brain damage, like I would never be the same again. And it was so strange because it was such a sudden shift from having this life of purpose and passion to all of a sudden not knowing who I was anymore. They told me at the time that I could take the medication for 6 months. And after that, there was a chance it was a fluke and I could try going off of it. But if I had another episode, it would mean that I actually had bipolar disorder, a lifelong chronic illness. So I did that. And, you know, after 6 months, because of the horrendous side effects, of course, I wanted to try going off. And I went off the medication. I worked really hard, exercising, eating healthy, everything, lost the weight. But within a year, I had another full-blown manic psychotic episode, which then was so much grief. I just felt like this is my life now. And so I kept taking the medication, went through another year of pretty suicidal depression. It's pretty miraculous I made it through that. I was able to work and function and be economically independent. But, you know, I had to deal with, I put on the 70 pounds again. I couldn't lose it. I've never felt physically well on those medications, and lived just many years in what I feel like was a limbo state, just feeling very sedated all the time, brain fog, fatigue, cognitive impairment, along with never being able to feel physically fit. All the things that I used to love, like exercise, went away. And then, of course, you know, prior to my illness, I had been really into health. I like to exercise and eat right. But after that, it just felt like, what's the point? Because I couldn't control this illness. So that's when I started negative coping habits, smoking, drinking, all those things. Eventually, I started working at a nonprofit organization that was into promoting holistic health. And that's when I started to try different kind of modalities like intermittent fasting, extended fasting. I gave up drinking and smoking. I started meditating, exercising. My life started to change. That's when I thought, you know, it's been 7 years of stability on this medication, but I still have all these side effects that I can't cut through. Like, maybe I should try going off my meds again. Didn't really do it in a safe way. So within a year, I had my third and hopefully final episode. The interesting thing to me about it, after learning about metabolic therapies, is that my third episode was the least severe of the 3 that I had, which to me was a sign that some of the fasting, some of the metabolic therapies I'd done had already started the healing process. But it was after I got out of the hospital in 2021 with that third episode that I discovered the work of Dr. Christopher Palmer and decided to start ketogenic therapy. So I never really, besides being on the medication in the hospital for a couple weeks, I went off of it again. I didn't really deal with tapering because I'd been off of it already for a year. But I started ketogenic therapy. It's been absolutely transformative for me. I'm now going on 3 years with only using metabolic treatments. My sole form of treatment's no longer on olanzapine, no symptoms of hypomania, let alone any full-blown mania. So that's why I became passionate and wanted to join Metabolic Mind and the team to help raise awareness of these incredible, powerful interventions. So thanks for being willing to hear our story and for the critical work you guys are all doing.
Wow. Thank you, Hannah. Well, I guess I don't need to say anything more about that. It's an incredible story of healing. Lauren, will you share?
Sure. So my journey toward being diagnosed with schizoaffective disorder was kind of more of a slow build than the quick onset. In my youth, I was always kind of quiet, but I had a lot of friends. I was pretty successful academically throughout my grade school years. I did competitive gymnastics, competitive soccer, was involved in multiple school student groups. But around 17...
Wait, wasn't there an astronomy?
Oh, I wanted to be an astronaut, yeah. Yeah.
We'll leave that out.
And when I was about 17, it was my grade 12 year, I began to experience what I now understand was the prodromal phase of schizophrenia. And I started to become really, really withdrawn and receded and struggled a great deal with school and motivation and cognitive functioning and all this stuff. And I lost my core group of friends and my life kind of started to fall apart a great deal. And I stopped going to school in grade 12. I skipped a lot of school as like a means of coping with the symptoms that I was experiencing, and I became really, really depressed. This obviously impacted my ability to pursue astronomy in university. I'm not sure if that's what I would have pursued, but I didn't
Life
get
is long.
Like, yeah, maybe there's still hope. I don't know. But I didn't get into university because obviously I didn't attend any of my grade 12 year, hardly, and I had very poor grades, but I still thought this was a path that I needed to take because that's what I always thought I was going to do. So I ended up going into open studies and kind of struggled my way through my first undergraduate degree. When I was about 23, I started my BSW, my Bachelor of Social Work degree. And that's when things like really, really deteriorated. And I started to experience symptoms of psychosis as well. I had a manic episode with psychosis that year. And that was the first... No, I'm getting real. I've been hospitalized many times. I won't get too much into the details of all those things. Throughout that period, I had 2 major suicide attempts, one where I was put on life support and almost didn't make it through. And it was a really, really intense period of struggle of my life. And that coupled with messaging from the medical system, there was a psychiatrist in one of my hospital stays who told me that I should probably live in a hospital for the rest of my life. And that was how severe my illness was. And that there really was no hope for me to live a life I had wanted at one point. And it was a really, really lonely, isolating, and hopeless period of my life where I did not know what was going on. My brain was not working. My conception of reality and my life was so altered. And yeah, it was really, really difficult. I was finally diagnosed with schizoaffective disorder when I was 25. So I struggled through my BSW and I managed to complete it. It was supposed to be a 1-year degree, but I completed it in 3. And I went the research path of social work. I was doing research around mental health systems, and then I moved into cancer care systems. And I was really, really passionate about this and really wanted to pursue this, and I loved the work. But inevitably, every time I got a job that I really enjoyed in this career path, like clockwork, about 3 months in, my symptoms became so unmanageable that I just kind of had to leave or would get pushed out of jobs because there was no accommodations really or understanding for the differences in my mental health capacity and whatnot. But yeah, so it was really, really difficult. I struggled a great deal for a long time. I've had multiple hospitalizations with psychotic episodes. But when I met my now husband, Rob, I had started to do some kind of advocacy work, sharing my story with a local organization called the Schizophrenia Society of Alberta, the province I live in Canada. And my husband had a background in video work, and he had started a YouTube channel about like photography tutorials. And he was like, you know, what if we tried putting your story up on YouTube? You could reach so many more people than the room full of people that you can reach going around speaking with the society. And I was like, okay, you know, I didn't really watch YouTube. I didn't understand it. I don't know. I was like, sure. But very, very quickly, the views started to go up. It started to gain a lot of traction, and people were really resonating with sharing my experience and my struggle. And, you know, it was something that people don't talk about. And so being able to hear aspects of my story that they related to or that resonated with them was really impactful. And so that was late 2018 that we posted our first video, and it's now both of our full-time work that we do. But yeah, throughout that, I guess it's been 5-6 years of working on this channel, there's been a tremendous amount of work around acceptance and trying to learn as much as I can about my illness and why it happens, what it means to live with it. And it's been helpful, but also kind of a frustrating journey in terms of never really getting full answers and still being met with this understanding that I live with an illness that inevitably comes with deficits, and that will always hold barriers for me in terms of not being able to access a life that I would like to live. Fast forward to, I guess, 4.5 months ago, we started a project using medical keto to treat and manage my schizoaffective disorder.
Lauren, how did you hear about this?
You know, back in 2020, I think we read some sort of article suggesting there could be some benefit to using the ketogenic diet to treat mental illness. And so we actually attempted it. We did it very, very wrong. I've learned much more since then and just kind of gave up because the pandemic started. I have 3 kids. It was very stressful. So just kind of put that on the back burner. But then maybe a year ago, we had Dr. Christopher Palmer back on the channel to talk about mental illness as metabolic dysfunction and if the medical ketogenic diet could be effective in treating illnesses like schizophrenia. And it got us a lot more curious and like, this could be a thing. And yeah, we connected with you and we're like, we're going to try this project. A bit of a gamble to do it completely openly. Like we've shared right from day one on our channel, every step of the journey of me using medical keto and metabolic therapies to manage my schizoaffective disorder. And like 4.5 months and it's life-changing.
Okay, we're gonna get into the details about the change of life that has gone on here, but let's hear from Wesley.
Thank you. Yeah. It's interesting. Whenever I do an intake with a new therapist or a psychiatrist or something, I start realizing as I'm talking the signs of either bipolar or OCD, another diagnosis that I have. From when I was a kid or when I was a teenager, because I used to kind of think that I had these like big trigger moments. Like I can remember my first obsessive compulsive episode. And now even as I was kind of thinking about how I wanted to share, I was realizing, well, if I start when I was a kid, I can think of a lot of OCD type tendencies. And there's a lot of incidents of what I would now know to be hypomania that were before kind of my first big episode that I can remember. But I was a very scrupulous kid. I was very thoughtful and quiet and sensitive, and I had a lot of obsessive tendencies. I remember scrupulosity, came from a conservative religious family, and I remember being obsessively concerned with questions of faith. I was also very concerned around safety and stuff like that. But that kind of went away during puberty, which I know can be typical for OCD. And so I kind of forgot about it. And I graduated from high school and I went to college, and I didn't know what I wanted to study, but I knew I did not want to be a doctor. Both my parents are doctors, and I had heard enough at the dinner table growing up. So I knew that I didn't want to do that. And I ended up stumbling and falling into helping get a startup off the ground that was making Band-Aids for darker skin tones. And I was getting that off the ground at my sophomore year, and working 30, 40 hours a week sometimes on that, and selling to hospitals and big box stores, and trying to push on social media, and also trying to keep my school going. And I can realize now that was probably hypomanic energy that was helping me, right? And at the time I was just like, I'm very productive, I'm very driven, I'm super motivated. But now looking back, I'm like, that's a clue that was probably an abnormal amount of productivity. Anyways, the summer after my sophomore year, I'm coming back to the suburbs of Chicago on a train with one of my friends. We had a night eating at this restaurant that we were excited about that had just opened. And I opened my phone, and I had a notification from LinkedIn that a police officer had viewed my profile. And immediately this obsessive thought jumped into my head, like, you've done something illegal that you've forgotten about, and they're going to get you for it. And that haunted me for the next year. And I became more and more kind of obsessive. I withdrew from classes. I became more and more non-functioning to the point where eventually I was diagnosed properly about 8 months later or something with OCD. And I started medication and started ERP and all this type of stuff. And started managing my OCD. And that goes on for a few years. I get into tech. I'm working full time. But I still continue to have, even though I feel like I've managed my mental health very well because I'm living with this previously incapacitating OCD, I begin to have these surges of agitation, energy. It was my wife who first noticed. She would say, like, Wes, it seems like you're behaving differently, or you have kind of this like abnormal amount of energy, and that continued to progress further and further. And I would also get very depressed and very suicidal, and I would experience these kind of mixed states where I would have the sentiment of depression and the feeling of being low, depressed, negative toward myself, but with the energy and motivation of mania. And I can recall very, very clearly, I was working remotely at the time. It was during COVID. And I had such an abundance of mental pain and energy, and it felt a freneticism that I just like got on my bike and rode like 20 miles in the middle of the workday, because I was like, I need to do something with this. And I eventually was working with my psychiatrist, and we were trying different medications. And she eventually said, you know what, Wes, I think that you have bipolar disorder. And I think what you're experiencing is swings between mania and depression, or hypomania and depression. And so I got on lithium and experienced a huge reduction in mania, and was, my eyes were open to the fact that I had been kind of in this state of hypomania. And that continued for several years, from maybe 2021 until last year. But I continued to have, even when I was, I guess the term is euthymic, even when I wasn't in a swing, because I was fairly well managed with the mood stabilizer, I had a lot of agitation, irritability, anhedonia. I just wasn't doing well. Even though I wasn't in a depressive state or a manic state, I wasn't enjoying my life. I was feeling kind of numb. I continued to have a lot of anxiety. So in that period, I was trying different antipsychotics. I was researching as much as I could with my limited medical ability to try to find what would be a useful lever that I could pull that I hadn't tried before that could be interesting. And at that time, this was a year ago now, June, my friend sent me a podcast with Chris Palmer. He's like, check this out, like some cool stuff about bipolar. And I was very skeptical, partially because my friend and I had disagreed about psychiatric medication before, just out of his experience. And he's not a doctor. We were just talking about it as friends. So I thought, oh, here we go. Like, I doubt this will work. But I listened to the podcast, and then I read the book, and then I sent it to my psychiatrist, and then I sent it to my parents. And my wife is a nurse, and she started looking into it. And I thought, let's give it a shot. So I gave it a shot. And I thought, this is pretty limiting diet. There'll be, cost to it in terms of like going out to eat with friends and stuff. But in terms of the potential upside, could be really worth it. So, I've been on it now for a year. So it's obviously been impactful enough that I've kept going. And my quality of life has improved noticeably. I would say like on the effect of, a really good medication. Like I've tried a ton of medications. I've experienced benefits from some of them, but all of the benefits come with side effects, be it akathisia, be it lethargy, be it weight gain. And keto has had the positive side of those medications without any of the side effects. The only side effect is obviously you have to eat the diet, but like that's that is what it is. So anyways, I'm thrilled to be here. Thanks for coming. Thanks for learning. I am interested enough in this space that I now work at a metabolic health company as well. So I'm bought into it from a career perspective as well, and think that it's an interesting lever. But yeah, that's my story.
Thank you, Wesley. I just wanted to bring up a few things that those three stories together bring to light. I think in psychiatry, we're always looking for phenotypes, and often we are looking at symptoms to dictate what those phenotypes might be or to give us clues. And these symptoms are all really different. These stories are all really different. The diagnoses are different. The onset is different. The expression of the illness is different. And so I think we need to be really careful when we're thinking about phenotypes to go beyond clinical presentation to something much deeper, probably metabolic. And so in all of your work, I know this is a deep part of what you're trying to do is to figure out what is the underlying physiology that is not driving the symptoms or the presentation of the symptoms necessarily, but that is representing the underlying metabolic dysfunction. That's what we have to figure out. So I'd just like to go a little bit deeper into the experience of trying ketogenic therapy. How did you do it? Who helped you? What did you eat? What other kinds of therapies did you try alongside? And any interactions with medications that might be interesting for the field? And we can just go in the same order, Hannah, if you wouldn't mind starting.
Sure. So when I started ketogenic therapy in 2021, at the time, Metabolic Mind didn't exist yet. Brain Energy hadn't even been published. I just found Dr. Palmer's website. And so I was really searching as much as I could for guidance. And I made so many phone calls trying to find a provider who would take my insurance and could help with ketogenic therapy, but I could not find anyone. I was really dedicated, though, to giving it a try. I just didn't want to go back. Since I had been doing the intermittent fasting and all these different metabolic therapies, exercise, and had finally started to feel like myself again and reclaim my physical health. I just couldn't imagine going back to taking an antipsychotic because I knew what was around the corner if I did that. So I just really wanted an alternative. So I decided to do it on my own, without guidance.
So you had already tried extended fasts, and
yes.
You had been on a vegetarian diet before that.
Yes, I'd been a vegetarian since I was a child. So I've stuck with vegetarian, mainly dairy-free, keto. I do eat some eggs now. Because I had done extended fasting, I was already metabolically flexible. So that was nice. It was really easy to get into ketosis. And then with the fasting, of course, developed some of the willpower needed to do keto. So it didn't feel that difficult. Of course, like anybody, I had moments of weakness and kind of in the beginning of the diet. But once I adjusted to it, I actually found it really satiating. I don't feel deprived at all. I really liked it. And as far as symptom reduction right away, because I had just gotten out of the hospital with mania, what usually would happen was really severe suicidal depression. But starting ketogenic therapy right away, my depression became not very severe at all. I wasn't suicidal. Within a couple months, it completely resolved. So,
And you have stayed on the vegetarian keto diet through this time, and I know you have other therapies that you had already been doing and that you've added on. Can you just say a couple things about that?
yeah, so fasting has been really powerful for me. So I still do intermittent and sometimes even extended fasting, which really helps with stress management. And then exercise is an important component of my metabolic therapies. It's a really good stress reliever for me. So I'm really into jogging. I've started doing more resistance training to build mitochondria in those muscles, but that's an ongoing process. So yeah, and meditation I think is really important. For me, meditation and journaling have helped me to adhere to ketogenic therapy. Just positive framing and reinforcing those good habits have been a key part of healing as well.
Thank you. Lauren? And you can all follow Lauren's journey in detail on Living Well with Schizophrenia. It's been an amazing YouTube channel for those who want to get into the nitty gritty, like testing your ketones, how to do it, going on a grocery store, seeing the meals. So we'll hear from Lauren, and then if you want to get the play-by-play, you can go to her YouTube channel.
Yeah, so we've gone pretty hard for the purpose of providing as much information as possible. Like Hannah said, it was difficult to find providers who were even open to it, never mind specialists in metabolic health. We put out a call on our channel, which has 300,000 subscribers, looking for a psychiatrist who would follow me through this process, and we couldn't find anyone. So I went ahead with my current psychiatrist, who was like, yeah, sure, let's try it. I don't know anything about it, but sure, I'll follow you psychiatrically through it. And my physician was also of similar mindset. And I have a keto coach, Nicole Laurent, who has been helping guide me and troubleshooting in various areas, which has been instrumental. Like, I did try it without her a couple years ago. It did not go well. Going so much better this time because she's just been such a good resource. We have, I say we because my husband is doing this with me, and that's perhaps of relevance because we've had very different experiences of getting into ketosis, which has been interesting. And so I understand that my experience is not necessarily indicative of everyone's, but I got into ketosis very, very quickly. Like, I was in ketosis basically the first week we started to adjust our diet. My ketones were very, very high throughout the whole process, like 4 or 5 millimoles per liter. And it instantly improved my mental health. I've gotten used to just living with symptoms, and I started to realize about 2 weeks in, I'm not taking notice of hallucinations or delusional thinking, or I'm not feeling paranoid. And so that was very interesting. But we meticulously tracked everything we consumed through an app called Chronometer, meticulously tracked ketones through blood and blood monitor, the Keto Mojo. I'm wearing a continuous ketone monitor right now. We've used that the whole time, which has been extremely helpful in terms of being able to troubleshoot what I'm eating and track ketone levels and stuff. Breathalyzer, urine strips, tested everything to let everyone know.
I don't think there's a YouTube of the urine strips, but there is
No.
a YouTube. Here's a YouTube video about putting on a CGM and a CKM and pricking your finger with the Keto Mojo, which I just found very helpful to see it live. So for your patients who are interested, yeah, can see the play-by-play. Go on. Sorry to interrupt.
I think that's it. I've moved away from tracking my food because that just, wasn't feeling great. I have a history of an eating disorder as well, and that's something that's come up from a lot of people worried that it will trigger eating disorder behavior. But this is not a part of your question, but I'll just let you know that I actually think that it has healed that aspect of my experience with mental illness, whereby my relationship with food feels so much healthier. And so to negate that criticism or whatever, but I was starting to feel that the meticulous tracking was perhaps triggering a little bit of the more dangerous patterns of my eating disorder. And so I made the decision, I've learned so much. I think I can do this without tracking now, and it's going really well. So, yeah.
Wonderful. Wesley?
Yeah, I think there were 2 categories for me. The first category was like staying motivated at the beginning. And the second category was actually learning what to eat and what impacted my my progress. In terms of staying motivated, I read Dr. Palmer's book, and that was while I was in the nitty-gritty of getting into ketosis and learning to adapt this new lifestyle. That kind of helped me keep my eyes on the end prize and stay motivated and understand, okay, there is a theory here, and there are other success stories. That kind of gave me a lot of motivation. I also, my wife did it with me at the beginning, and then I had another friend who was diagnosed with bipolar 2 who also did it. So being able to stay in kind of some type of accountability was very, very useful, especially with a peer who was experiencing the ups and downs of symptoms going away or not going away or whatever. So that was that. Now, in terms of a year ago, this space is moving so quickly that there were a lot fewer resources a year ago even than now. So I think our experience was probably pretty similar. I spent a lot of time on Reddit, a lot. And there's a lot of really interesting stuff on Reddit and a lot of very bad stuff on Reddit. But I tried to sift through the chaff and the wheat as well as I could. And then Chris Palmer's book was very helpful. And then talking to people who were a little bit ahead of me in the journey, just to be able to text them and say, and I started meeting those people as we got connected, through the Brain Energy group and, all this type of stuff. So yeah, that's kind of my experience. It definitely was not as precise or frictionless as it could have been. And it probably would be now, hopefully, with some of the resources that are coming out.
And what kind of diet, what do you eat typically?
I do not eat breakfast. For lunch, I will typically have some kind of fatty protein, eggs, sour cream, maybe a small salad. For dinner, I will have maybe a small salad and some kind of fatty protein, and cooked in butter or oil. So pretty basic, I think. I think my wife probably suffers the most because she's just bored. But it's a pretty, I would say, a pretty basic diet. I've tried experimenting with MCT oil. I haven't found that to be particularly helpful in my own case. But yeah.
And are there other things you do besides the nutrition side of it that you feel are helping your metabolism?
Yes. My light glasses. So I've tried a light box. I used to live in Chicago, so lots of people had light boxes for SAD. But I always found that I couldn't stay in front of it long enough for it to be impactful. So I bought these little glasses from Belgium that go over my eyes and beam light into my eyes. So I do those every morning. That's been helpful. I exercise while fasting 4 to 5 times a week. I have a prayer meditation practice. What else? Lots of sodium supplementation. I'll think of other things, but that's the main kind of regimen.
Are you still on lithium?
Yes, I am still on lithium.
Maybe that's a good segue into talking about medications. And Hannah, you were not on medications when you started ketogenic therapy. Lauren, you have tapered off some, and we can hear from Wesley. I'll share that with my son. He was on 5 medications at the time he started ketogenic therapy. He's now on 3 very low doses. It has been relatively easy or difficult for him to get off depending on the medication. Lithium was easy, benzos were hard, antipsychotics are hard, carbamazepine has been hard. I don't think he would have gotten off of benzodiazepines without the ketogenic diet. We saw got a lot easier once he was in ketosis, but it has been no means easy. He's on about 20% of the medication load that he was on, although that's a pretty imprecise calculation. I would love for someone to come up with a total medication load calculator math. So Hannah, can you just share your experience of having been in the hospital the last time, and then did you just stop as soon as you came out?
Yeah, I know.
All the psychiatrists in the room are shaking.
I know. Well, I was put on medication when I was in the hospital. I stayed on for probably a couple weeks after getting out. But again, it was after just starting to restore my health again, I had gotten to a point where it was I would almost rather experience an episodic illness than to always feel a diminished quality of life and feel so sedated and not myself all the time. I just couldn't do it anymore. And I knew exactly what was going to happen if I stayed on the olanzapine for an extended time because it had already happened to me. So I just was desperate to try an alternative. Of course, I knew there was a big risk having just gotten out of the hospital and deciding to do that. But I did see a counselor at the time who was kind of monitoring me for symptoms and asked my family to keep an eye on me while I was doing it. But I think it gave me the advantage of, because I'd only been on it for such a short time, not really needing to taper in the same way. And I did keep medication in my medicine cabinet. It's still there, the olanzapine. I was always like, in case of emergency, I would take it if I needed to, but luckily I haven't needed to. And just as a patient advocate, I meet so many people with different perceptions of medication. For some people, they don't experience negative side effects. And I would never say like, you should switch to ketogenic therapy. Like, this is just about making people aware that there are other options. And I'm certainly not anti-medication. And I know a lot of people who are doing it, like Wes, like as an adjunctive therapy, that's still really helpful. So
Yeah, I would say most of the people that are going on ketogenic therapy aren't touching their medications at first, and that's kind of the advice. That's the typical advice. Just stay on your medications and add this as an adjunctive therapy. However, sometimes with some medications, including antipsychotics, you can get a potentiation effect, and I'll let Lauren tell what happened to her.
So yeah, medications. I had a psychotic episode actually just in June, so about a year ago, and even on medication, and I came out of the hospital on like 140 milligrams of lorazepam, 2 doses of Haldol a day, mood stabilizer, and then more meds for the side effects of all of those. And that's kind of where I was at. I eventually worked my way down to 100 milligrams of lorazepam, and that's what my starting point was.
And had you tapered off the other medications?
I got off the Haldol and the mood stabilizer, actually, yeah. And so when I started this project at the end of December, I was only taking 100 milligrams of lorazepam. But about 3 weeks into following the ketogenic diet, I couldn't get out of bed. I was so sedated, I could hardly think. And I just felt not good. And so I let Nicole know about this, and she said, you're probably experiencing potentiation, whereby the ketogenic diet is improving your metabolic health, thus reducing your need to be on such a high dose of antipsychotic medication, and you're experiencing far more symptoms or side effects of that antipsychotic medication. And so the sedation that I had kind of always experienced from that antipsychotic was times 100. And so I, with my psychiatrist, was like, I let him know what was happening, and he was like, okay, well, let's try reducing it. And so we reduced it down to 80, and I felt improvement almost immediately in terms of feeling less sedation, but I was still feeling sedated. And so I went back to my psychiatrist, explained what was happening, and he was like, let's try 60. So we went down to 60, and that felt really good. So very, very clear what was happening based on what happened once I reduced the antipsychotic. And that was good for several more weeks. And then it actually started to happen again, where I was experiencing more of the sedation again. And I tried to push through it a little bit, because I started this project thinking I was not going to touch my medication for at least 6 months until I was absolutely certain that the medical ketogenic diet was effective in terms of managing my illness. And I was scared to touch my medication. But yeah, this happened, and don't make plans, I guess, And so I'm currently on 40, and that's been for about 8 weeks now. And yeah, the plan is to try to keep tapering if everything is going well.
I think this is such an important topic, because different medications interact differently with ketogenic diet and with each other. When Matt went on, once he was in nutritional ketosis, we were tracking lithium and carbamazepine blood levels. The blood levels dropped by 35% exactly for both medications. And if you didn't have a provider who understood what was happening, they might have increased the dose, even though his symptoms were reduced. So these are some of the things that we really need to be looking at. It has been frustrating to me that no one would ever take antipsychotic levels in clinical practice. I kept asking, well, how are we going to know what's happening? It was just kind of a guess. So I think in some of the studies we've been talking about taking levels for antipsychotics and other medications, so that we can try to figure out what's happening and compare that to what's happening clinically. Wesley, did you want to weigh in on anything you've noticed with your medications and who your treatment team is?
Yeah, I work with a just a therapist and a psychiatrist. My psychiatrist, actually, I moved to Austin about a year ago, and my psychiatrist in Austin is not knowledgeable about keto at all. My psychiatrist in Chicago was, with whom I started. I now feel like I can advocate for myself, but if it would have been difficult to start under this care, I think. That's an aside. My experience has been that I'm trying to remember the medication I was on when I started keto. I think I was on lithium, lamotrigine, and potentially Abilify. The biggest thing that I observed from keto was a huge reduction in anxiety and agitation. And so I went down to just the lithium. And then I've had a resurgence of some irritability and agitation. And so I've worked with this psychiatrist to find a potential little helper to help out with that. But we have not had luck because the side effects, and potentially from, what you were describing, Lauren, the side effects have been very extreme from all of them, particularly somnolence, even the ones that are newer and are not indicated for that as much. I've been like way on the sedation. I've been like zonked out on them. So yeah, we're still trying to figure out if there's a medication that could help with some of the irritability side of things. But I remain on the lithium. I get my blood levels pulled for the reason that you were, describing. But yeah, I've also experienced severe side effects from antipsychotics that are not necessarily like as indicated, just potentially because of being in ketosis. Yeah.
I think it's also really important to pay attention to withdrawal effects. Lauren has experienced some of that. My son definitely has experienced that. And often our experience is that psychiatrists don't want to talk about withdrawal effects. They want to talk about organic illness returning as a result of dropping the medication, and that is not what is happening. It's really important that we listen to people's experience, and they have been watching their symptoms closely for years. They know the difference between a side effect and bipolar disorder returning, and it's important to differentiate between those, and we need to do that work. And maybe you could just share a tiny bit about what you experienced with the last drop.
Yeah. Antipsychotics are not fun. Multiple times oftentimes it stems from delusional thinking about the medications being poisonous, that I stopped taking them. And immediately I get psychotic and end up in the hospital. I've done that 2 or 3 times. And so I was told, like, you need medication, your illness is returning as soon as you stop it. But what I'm kind of learning is maybe actually happening was like extreme withdrawal, withdrawal-induced psychosis. When I went down from 60 to 40, just like a couple months ago, I experienced very, very difficult symptoms of withdrawal. My cognitive functioning was impaired. It felt a bit like inklings of psychotic symptoms kind of returning. Like the agitation was increased. And, even going through this and kind of knowing that was going to happen and knowing that keto was helping me, I still was like, oh my God, do I need to go back up on my antipsychotics? I think my psychosis is returning. But pushed through it, and about 3 weeks later, I was okay again. It was very, very clearly withdrawal effects of reducing the antipsychotics. And so the lorazepam, whatever is 20 milligrams is the smallest. And so I think going down by that much is probably too much.
We're going to find a compound pharmacy to make 5 milligrams.
Yeah.
Which is how we had to approach it with our son. Go ahead, Wes.
I was just going to say the worst experience I've ever had with a medication, and I've tried probably 10 antipsychotics, so I've had a lot of weird stuff with them, but was withdrawal from Zoloft. After being on it for 5 years for OCD, it was like the first line treatment that I had for OCD. They were like, just try, sertraline, you'll be great. It was great. It changed my life at the time. But coming off of that, I remember after being diagnosed with bipolar 2, and my psychiatrist was like, we shouldn't have you on this, was absolutely like gut-wrenchingly terrible. For about 2 months, I had a combination of brain fog, depersonalization, a sense of time passing differently, but it wasn't significant enough to be, it wasn't like acute enough to be like really, really earth shattering. It was just in the background at all times. And I was like, is this ever going to end? So yeah, and that's like, you know, people write prescriptions for Zoloft and Prozac and stuff like like SSRIs, like no problem, right? But coming off of that after 5 years, and there are people been on it for 30 years, you know? So anyways, withdrawal is very real. Yeah.
And I just want, I'm going to open up to questions, but I just wanted to ask you, what feels different now? It's been 4.5 months. Hannah, you're like almost 3 years. Wesley, you're almost a year in. My son is 3 years in. He continues to get better and better. You can kind of see the healing happening, which we haven't seen with any other interventions. So could you just 1 minute say what feels different now from before you went on ketogenic therapy?
I think my life is completely different. I actually consider myself in complete remission from neurometabolic dysfunction. I don't consider myself someone who has bipolar disorder right now. So I feel like my creativity returned, my cognitive functioning's back. I'm able to be physically healthy, and life is just better than I actually ever thought it would be following that devastating diagnosis. So.
I mean, I almost started to cry earlier when I thought about this aspect of it, because yeah, it's been 4.5 months and my life is completely changed. I think I say this too much, but my capacity has just increased exponentially. I feel like the blocks I kept running up against for a decade plus of experiencing and living with the illness are being removed before my eyes. I feel like I can show up better for my family, for my kids. I can show up better as a partner. I can show up better in work. I can show up better for myself. And it's a little bit difficult to kind of wrap my head around the breadth of how it is changing my life. You know, I think an element of living with a mental illness is kind of coming to understand yourself, with that being part of your identity, even if it's just an illness that you live with, because it just affects the way you experience the world so profoundly. And so having that altered and changed and stepping into a new understanding of myself without those deficits and limited capacity is quite profound.
Yeah. Yeah, along those lines, for me, the biggest, well, obviously I've noticed a physical benefit. I am less anxious. I'm more clear-headed. I think my mood is more stable, but maybe even more profound than that, and along the lines of what you were saying, Lauren, is like I feel hopeful because I have a new lever to pull that I didn't realize was a lever. You know, like I knew medication. I had been in that world since my OCD diagnosis in 2016. I knew therapy. I had done so much work in that, and you know, with ERP or CBT type stuff or internal families, whatever it was. But this was like a brand new tool for me to use that could give me hope that was related to the other things, but also independent of them. And so I could benefit from it in addition to and independently of those other things. So it just has given me a lot of agency and a sense of autonomy and hope. Yeah.
Questions for our wonderful, wonderful panelists, and I will just thank you all.
Thank you so much. I mean, these stories are really incredible. They're very, very motivating as a scientist. Very exciting. I'm so happy for you and so happy for the field. I have a question that is both a practical one and also a scientific one combined, which is it takes a while for someone who's never been on a ketogenic diet. It takes a bit of time to transition their bodies into being able to be in a state of ketosis reliably. And then past that point, once they are now in ketosis, the question that I get asked a lot by patients is,
how long should I expect it to take to actually feel noticeable results? Because it is easier to stick with something that feels a little foreign if you feel like you should be getting some reward out of it within some finite period of time. And obviously that'll change from person to person. But I'm wondering if you could speak to, for each of you, like how long you felt that, how long did it take? Both in terms of the physical, the transition to ketosis and then the transition to feeling different.
Yeah, this is a great question. And believe me, I spent a lot of time on Reddit trying to get this answer in the first couple of weeks because I was like, when is this going to start working? I'd say probably around week 3 or 4, I started having good days and little breakthroughs where I would, for, a few hours or an afternoon, be like, wait a second, I haven't been as anxious for the last 4 hours. Wow, this feels good. And then I would kind of slip back into it. And then maybe week 5 or 6, I started having more good days than bad. And then started, after that to be in a steadier state. So I would say somewhere in the 4 to 6 weeks was when I could notice it. I did have positive benefits before that in terms of more energy. It just wasn't necessarily mood related. Like I would wake up feeling more rested the 2nd or 3rd week, and I could notice that. In terms of how I felt differently, or when I kind of could know that my body was getting used to being in ketosis, was probably in the 4 to 6 week mark as well, because I stopped getting as hungry. I stopped having cravings. I could go longer in between meals. Like I tried some fasting and I was like, this is much easier than last week or the week before. So that was overall about the 4 to 6 week mark.
So if I'm understanding you correctly, the physical transition and also the psychological transition were essentially happening at the same time?
Physical a little bit ahead of psychological. Physical, like for example, week 2, I started waking up more rested and I felt, I have more energy. I'm going to empty the dishwasher in the morning instead of waiting until tonight. But then in terms of and I remember cooking my wife breakfast because I was up and, ready to go. But then I started feeling mood wise better 4 weeks in maybe.
So I had done quite a bit of extended fasting, so I was able to get into ketosis right away. And one of the reasons that I was so optimistic that this form of therapy could work was as a fasting mimicking diet, because I already knew that I felt a difference in mental clarity and energy when I was in ketosis from my experience fasting. So I felt quite a bit of relief from the depression after getting out of the hospital, immediately. And then it completely lifted within a couple months. And getting to talk to so many people with lived experience, I think this is a fascinating question because there's appears to be so much variability. There's some people who feel it within days, sometimes it's weeks, sometimes it's months. I've heard Dr. Palmer say people should give it at least 6 months to see a difference. So just people need to know that there might not be a clear answer and a lot of it's individualized.
Along those lines, I run a lot. And I often would skip breakfast. And so I don't know if that increased my metabolic flexibility because it was the day after I started keto, I had 1.5 ketone levels. So I got into ketosis very, very quickly. I did not experience keto flu. My husband did, and it looks awful. So
Sodium. Yeah.
Electrolytes, yeah. But I can see how that would suck if you're going through that, and it would be unmotivating to continue with it. But I did not experience that, and I started to really notice improvements in my mental health about a week and a half, 2 weeks in, and it's just kind of kept improving since then.
I would just add to that a lot of people see metabolic, especially people who have overweight or obesity, see the metabolic impact right away, and then that's kind of enough to keep them going, and then ultimately the psychiatric symptoms will come in after that.
Question, how much has your weight changed since starting the keto diet, and how long did it take for your weight to stabilize? And another question also, how did this correlate with your symptoms?
I lost probably 6 pounds in the first couple days, which is very typical water weight loss. And then overall in the last year, I've lost probably about 20 pounds, and that's without trying. I've never counted calories on the keto diet. In terms of how it's, I don't think weight loss has in any way very actively interacted with my symptoms. I feel better overall health-wise. So maybe, I'm sure there's some kind of little halo effect there, but yeah, about 20 pounds to answer your question.
So as I had mentioned, I put on like 70 pounds on olanzapine. I lost quite a bit of that, like when I started doing the intermittent fasting and everything for the year before keto. On keto, I probably lost about 30 pounds total. And and it has made me feel better. Just feeling physically better, I think, always helps our mental health, just to feel fit and active.
People on our channel are constantly coming at me for losing too much weight and whatever. So I think I look thinner, like if I've lost inflammation in my face or something, but I've actually gained weight. I gained 4 pounds, but I had like a body composition screening done at the beginning and 3 months in, and it was 4 pounds of muscle that I put on because I've been doing more weightlifting and stuff like that as well. So
this is a really important point, and maybe Guido's going to talk about this, but we get people critiquing the Stanford study because most of the participants in the Stanford study were obese. And people said, oh, the improvement in psychiatric symptoms is only because of the weight loss. And I think it's important to note that we have evidence here of weight gain. And we have evidence, of course, in Guido Frank's study that he's going to talk about later, of weight gain and psychiatric symptom improvement on keto.
Thank you all for sharing these really remarkable stories in this great detail, which I think is really helpful to conceptualize for all of us who are clinicians and researchers. Wes, I have 2 questions for you. One is, what happened to your OCD symptoms in relation to the ketogenic diet, and how quickly did you get off the Zoloft?
When I got off the Zoloft in 2016?
Now, so over what time frame were you discontinued off the Zoloft? Did you do that over a month, 2 months, and what happened to your OCD symptoms?
Okay, so this was before I did the keto diet. This was in 2021 that I got off the Zoloft. I got off of it over perhaps 3 or 4 months. It was a good taper. I was on 200 milligrams a day, which is, I guess, like upper limits, but typical for OCD. I didn't experience a huge resurgence in OCD symptoms, mostly because I have spent a lot of time doing exposure response prevention therapy. So it was very managed at the time. I was just kind of on it as like a vestigial. It just was still there. And that's why we felt okay coming off of it. But yeah.
And your OCD symptoms, have you noticed a change at all, or was that already resolved?
No, I still wrestle with it. It's hard for me to tell because the ones that get me now are much more nuanced than they're like relational OCD. It's no longer like the danger ones, or the ones that are easier for me to identify and like sequester. And so the ones that get me now are more nuanced. With keto, I have felt a quieting of them. Yeah, it was less probably impactful. Like the keto has not impacted them as much as it's impacted mood, but it has quieted them a bit. Yeah, so it's been a good benefit.
Thank you very much for incredibly inspiring stories and accounts of your experiences. One of the challenges that I've run into in my clinic is convincing people to try this. And I've had a number of individuals just give me a hard no. I've had individuals who have tried keto diets for other purposes, including weight loss, and so they've had experiences with it, and they were hesitant on it. Now, I'm probably not inspirational enough for them to convince them to try it, or there's something that I'm lacking in doing it. But I'm interested to know how you respond to people who contact you to say, I tried it and I'm having a heck of a go of this, and here are my difficulties, or are you hearing people come and talk to you like this, and how are you responding to people who are struggling with with moving forward on a keto diet?
Yeah, we just talked about this at lunch, so maybe I'll hand it over to Lauren, who could talk about her experience of trying it before.
So what would I say to people who are having a difficult time with it? So I think having tried it once and it not having worked, like I didn't try it for long enough, but I did so many things wrong. Like there is not enough information out there right now about how to do it properly, especially when it's so muddled with weight loss keto. And there's so much, conflicting information about how to follow medical keto specifically. And so, yeah, I would encourage, if they have you as a resource, that's great. But if someone else, having a keto coach really helped me to address that. But, getting to a deeper level of that immediate no that's coming up, I think that's something that has been a little bit shocking and difficult to process through sharing my own experience on the internet. And how, to me, it just feels like you would see that and you would go, wow, this worked for her. Maybe this could work for me. Maybe I could apply some of these to my own experience and alleviate my suffering. But that is maybe 50% of the reaction. The other 50% is people feeling attacked, might be the wrong word, but I spoke about how mental illness really gets conflated with your identity. And so I think that that's been a really interesting thing to kind of wade through the process with reception of this as a therapeutic intervention, whereby people feel like their identity is being attacked by providing an alternative treatment like this, as opposed to what we've been taught this whole time, that to be a good patient means taking your medication as prescribed, and that's really about it. And I guess it feels intimidating to have this other way of thinking proposed to you. And so, yeah, that's been interesting.
I was just going to say the way that I found to be most, useful to help people understand it would be to focus on metabolic health overall and not just the diet. Because there's other things that they can try. Well, obviously, if you're running a clinical trial on keto, there's not. But if somebody came to me and they said, hey, I have bipolar disorder and I want to improve myself, there are other things they could try, like circadian rhythm-wise, exercising, fasting. And so, for me specifically, it was very helpful to think about metabolic health as this new realm of my life that I could use to impact my mental health reality. And keto was one portion of that. And that made keto feel much less like it was this oppressive diet that I had to adhere to very, rigidly. It was like, oh, cool, another little tool in the metabolic toolkit. And hey, this is overall helping my mental health. So that may not be that helpful to you, in terms of getting them to do a trial, but in terms of getting people to improve their metabolic health, that's the approach that I typically take.
I think one of the main things is, as a patient advocate, I just want people to know that this is an option. And of course, this is something that somebody has to choose. And maybe it's not the choice that everybody wants to pursue. But I think when Lauren's saying 50-50, I think our job is to inspire those people who are desperate for another solution. And it's those people who are going to share their stories and eventually create more inspiration for others as they can see that this really works for some people. And I thought it was interesting. We heard from a young man who was really inspired by Dr. Sethi's study and said, he tried keto in the past, but after seeing those results, he's like, I really want to give this another shot. So I just want to emphasize how much your research really does matter to patients as well. And that being able to see that makes a big difference and is very motivating for people. So thanks for the work that you're doing.
I had a comment and a question. So my comment is, one, thank you all for coming today and sharing your voice. It's an important part of what we do as clinicians and as scientists. My question really has to do with sort of the psychological component as it relates to the metabolic component, which is, how do you find that the sense of agency and hope and effectiveness interacts with the metabolic effects of the diet for you individually?
I love that question. That is so interesting, because I think when I emphasize meditation and positive framing, journaling, I think it's all interconnected. And we know even physiologically, placebo effect is a real thing. So I always try to leverage that. And I know that I talk to myself about the healing impact of the diet and the difference that it makes in my life. And kind of an interconnected facet of this that I just keep meaning to mention. One of the most interesting things about this form of therapy, I think, is that while you get some of those quick benefits, like immediately and within the first few months, so much of it is incremental and over time, which I think really ties into the theory that this has to do with mitochondrial function that is kind of slowly repaired through the mechanisms of a fasting mimicking diet, mitophagy, mitochondrial biogenesis. So I feel like my healing really kind of peaked at a year in, but seeing that incremental transformation is really amazing, which again, I think is another thing that can motivate patients, is just talking about this as a gradual healing process that gets at the root cause, and unlike medications can potentially put an illness into remission, which I think is a totally different kind of motivation. So
yeah, it's a feedback loop. Like that's what I was trying to get at in my little closing statement, was the sense of agency and hope as I listened to these podcasts and read the book and talked to my friends made me adhere to the diet more, because I was excited. There was like a sense of agency. There was a sense of, okay, this isn't, Latuda changing my brain. This is the choice that I made, 4 hours ago at the dinner table, changing my brain. So yeah, it becomes a positive feedback loop where, you are doing better because you're adhering to the diet. So you add in some exercise, and then that gives you more energy. So you add in a meditation practice, and that gives you more mindfulness. And so you reach out to a friend, and that social energy is helpful, so it compounds, I think. Yeah.
I was going to say exactly what Wes just said. It's a lovely little feedback loop. And the more capacity you have, the better you're able to show up taking care of yourself, which ultimately improves your metabolic health even more. And thus it repeats.
I would just add that it's not just psychology, right? It's also cognitive function. The way my son objectively measures his success is by his chest rating, which is higher than it's ever been. So he's happy.
And that seems like a perfect place to wrap, from hearing from all of you. And thank you again. I think all of us in this room are so grateful.
Thank you all.
I hope you enjoyed that lived experience panel as much as I did. It's always so inspiring and educational to hear people's stories and their journeys, and so important for the researchers at the SOBP conference to hear that as well. So if you want to learn more, please visit our website, metabolicmind.org. We have a whole section devoted to resources for clinicians and for all individuals to help you learn more and help you on your potential journey of ketogenic therapy for brain-based disorders and for mental health. So thank you for joining us, and we'll see you next time here at Metabolic Mind.